Question 1. A technician in the prep area receives an urgent call from the operating room regarding a dropped bone clamp that is needed immediately to continue the procedure. The technician cleans the item and prepares it for a rapid cycle without a standard storage wrapper. What is the currently approved term for the cycle the technician is about to run? A. Emergency flash processing. B. Immediate use steam sterilization. C. Unwrapped core sterilization. D. Rapid turnaround reprocessing. Correct answer B. Knowledge point explanation. Core rationale. According to AAMI standards, the outdated term flash sterilization has been officially replaced. The precise term for processing an item for immediate patient use without terminal packaging is immediate use steam sterilization. This process is strictly reserved for urgent situations like a dropped instrument and cannot be used for routine inventory management. Trap analysis. Option A. This is an obsolete and incorrect term that mixes emergency with the outdated word flash. This option would be correct if the question asked for the historical term used prior to current AAMI revisions. Option C. Core sterilization is a fabricated term not recognized by industry standards. This option would be correct if the facility specifically used a localized slang term for their central core sterilizers, but it is never the correct exam answer. Option D. Rapid turnaround reprocessing is a general descriptive phrase of workflow efficiency rather than a specific cycle name. This option would be correct if a manager were describing the overall goal of the decontamination workflow during a busy shift. Concept extension. Items processed via this method must still undergo full and complete decontamination before being placed in the sterilizer. Skipping the cleaning step is a critical safety violation. Question 2. A department manager is reviewing processing times and directs the technicians to route the vast majority of stainless steel surgical sets through the standard autoclaves rather than the hydrogen peroxide systems. What is the primary operational rationale for the technician to utilize this specific routing decision for heat-resistant items? A. The cycles are significantly faster and cost less to run. B. The temperature parameters automatically adjust to safely process heat-sensitive plastics. C. The cycles eliminate the mandatory requirement for routine biological monitoring. D. The process allows technicians to bypass the use of internal chemical indicators. Correct answer A. Knowledge point explanation. Core rationale. Steam sterilization is considered the primary workhorse of the sterile processing department because water is a cheap sterilant and the cycle times are much shorter compared to low-temperature methods like ethylene oxide. It leaves no toxic residue and is highly efficient for standard stainless steel instruments. Trap analysis. Option B. Steam cycles utilize extremely high heat that will permanently melt or damage heat-sensitive items. This option would be correct if the technician were specifically loading a hydrogen peroxide or ethylene oxide sterilizer. Option C. Biological indicators are strictly required for steam sterilizers to verify lethality. This option would be correct if a technician were performing a daily diagnostic Bowie-Dick test which only checks for air removal and not biological kill. Option D. Internal chemical indicators are mandatory for every single package processed in a steam cycle. This option would be correct if the question described an unwrapped item being immediately sterilized where an internal indicator cannot be contained within a package. Concept extension. While steam is the most economical and fastest method, technicians must always consult the manufacturer instructions for use to verify an item can withstand temperatures up to 275 degrees Fahrenheit. Question 3. A technician is transferring a heavy wrapped orthopedic tray from a cooling cart to a wire shelf in the sterile storage area. Before setting the tray down, the technician verifies the expiration date on the lot sticker. What other critical physical inspection must the technician perform on the item at this exact moment? A. Ensure the internal chemical integrator has reached the passing criteria. B. Verify the external wrapper is completely free of rips, holes, and moisture. C. Confirm the biological indicator vial has turned yellow. D. check that the exact surgeon name is clearly printed on the load card. Correct answer B. Knowledge point explanation. Core rationale. Event-related sterility dictates that an item is only considered sterile if its packaging remains completely intact. Before placing any item into storage or dispensing it for use, the technician must physically verify that the barrier has no holes, tears, or wet spots that could allow microbial ingress. Trap analysis. Option A. The internal integrator cannot be checked without opening the sterile barrier and destroying the tray sterility. This option would be correct if the question described a scrub nurse opening the tray inside the operating room. Option C. A biological indicator turns yellow when spores grow, indicating a sterilization failure. This option would be correct if the technician were documenting a failed load that requires an immediate recall. Option D. Standard instrument trays are generic and do not require a specific surgeon name on the label. This option would be correct if the technician were preparing a highly customized vendor loaner tray requested for a specific patient. Concept extension. If a technician discovers a tear in the wrapper while placing it on the shelf, the item is immediately considered contaminated and must be sent back to the decontamination area for a complete reprocessing cycle. Question 4. A new technician is assigned to operate the ethylene oxide machine for the first time. The department educator mandates a strict orientation covering environmental monitoring protocols, exposure limits, and proper handling of the gas cartridges. Why is this specialized safety training absolutely critical for technicians operating this specific equipment? A. The chemical liquid and vapor utilized to eradicate spores possess highly toxic and carcinogenic properties. B. The low-temperature environment accelerates the rapid corrosion of delicate camera lenses. C. The cycle parameters require frequent manual adjustment to prevent costly equipment malfunctions. D. The lack of established regulatory standards requires technicians to monitor the exhaust manually. Correct answer A. Knowledge point explanation. Core rationale. All low-temperature sterilants such as ethylene oxide and hydrogen peroxide are potent biocidal agents designed to destroy living organisms. Because they are toxic chemicals, they pose a severe safety hazard to employees, including respiratory damage or chemical burns if not handled precisely according to OSHA and AAMI protocols. Trap analysis. Option B. Low-temperature methods are extremely gentle on delicate items and do not cause corrosion. This option would be correct if the technician were mistakenly running delicate electronics through a highly corrosive steam cycle. Option C. Modern sterilizers are fully automated and manual adjustment of parameters mid-cycle is prohibited. This option would be correct if the technician were operating an older manual ultrasonic cleaner where degassing times must be set by hand. Option D. Ethylene oxide is heavily regulated by multiple strict standards including OSHA exposure limits and EPA emission laws. This option would be correct if a facility were testing an experimental prototype chemical that had not yet been reviewed by the FDA. Concept extension. Ethylene oxide requires extensive aeration time after the cycle to remove residual toxic gas from porous items before they can be safely handled by staff or used on patients. Question 5. A technician in the decontamination area is rushing to process a titanium bone screw set for an ongoing trauma surgery. The circulating nurse calls and demands the set be placed in an unwrapped rapid steam cycle to save time. According to established industry standards, under what specific condition is the technician permitted to process this permanent implant using this emergency method? A. When the exposure phase is extended by 10 minutes to compensate for the rapid heat transfer. B. When the implant is packaged in a paper plastic peel pouch instead of a heavy rigid container. C. When a documented tracking system is utilized to directly link the specific item to the receiving patient. D. When a double cycle parameter is selected on the autoclave control panel to ensure complete lethality. Correct answer C. Knowledge point explanation. Core rationale. Regulatory bodies like TJC and AAMI maintain a strict zero-tolerance policy for using immediate-use steam sterilization on implantable devices because the process bypasses the required biological indicator quarantine period. It is only permitted in extreme documented emergencies where an immediate tracking system ensures the implant can be traced directly to the patient in the event of a subsequent biological failure. Trap analysis. Option A. Extending the exposure time does not negate the requirement for biological quarantine. This option would be correct if the technician were processing instruments known to be contaminated with prion, which require extended cycle times. Option B. A standard paper plastic pouch cannot be used in a rapid cycle intended for immediate use without dry time. This option would be correct if the technician were preparing a single lightweight retractor for terminal sterilization. Option D. Running a double cycle is against manufacturer instructions and damages instruments without providing additional safety. This option would be correct if the question described an older facility policy for treating heavily soiled biohazard waste before disposal. Concept extension. A standard load containing implants must always be monitored with a biological indicator and an early readout integration indicator, and the load must be quarantined until the biological test result is negative. Question 6. A technician is performing daily morning maintenance on a steam sterilizer and notices water pooling at the bottom of the chamber. Upon close inspection, they find the drain screen is completely obstructed. What is the most frequent operational culprit for this specific chamber blockage? A. Mineral scale deposits from poor boiler water quality. B. Dislodged metal pieces from the chamber muffin baffle plate. C. Chemical indicator tape that detached from wrapped packages during the cycle. D. Excessive fabric lint shedding from reusable cotton wrappers. Correct answer C. Knowledge point explanation. Core rationale. The drain screen is located at the bottom of the sterilizer chamber to catch debris and prevent clogs in the plumbing. The most common debris found here is indicator tape that was not properly secured to packages and fell off during the pressurized cycle. If this screen is clogged, air cannot be removed and steam cannot circulate, leading to a sterilization failure. Trap analysis. Option A. Mineral scale deposits affect the boiler and internal pipes over a long period rather than causing an acute sudden blockage of the physical drain screen. This option would be correct if the question asked why a sterilizer chamber wall has chalky white stains. Option B. The muffin baffle plate is a sturdy metal component that deflects incoming steam and does not typically break apart into the drain. This option would be correct if the question asked what component prevents steam from directly hitting and wetting the load. Option D. Lint can accumulate over time, but tape is the most frequent acute cause of a fully clogged screen. This option would be correct if the question asked what material hazard causes microscopic foreign body reactions in patients if left on instruments. Concept extension. Technicians must visually inspect and clean the drain screen daily under running utility water to ensure proper sterilizer function. Question 7. While manually cleaning a heavily soiled Yankauer suction tube in the decontamination area, the technician needs to ensure the narrow internal channel is completely free of blood and biofilm. Which physical action is absolutely mandatory to successfully achieve this outcome? A. Flushing the channel with warm utility water using a high-pressure syringe. B. Immersing the device entirely in a neutral enzymatic solution for a minimum of 3 minutes. C. Pushing a rigid wire stylet through the entire length of the channel to clear solid blockages. D. Scrubbing the interior walls along the entire length utilizing an appropriately sized brush. Correct answer D. Knowledge point explanation. Core rationale. Friction is the most critical element of the manual cleaning process. For lumens and suction tubes, flushing and soaking are not enough to break down the sticky protective layer of a biofilm. A technician must use a proper-sized brush to physically scrub the interior walls of the channel to guarantee all soil is detached. Trap analysis. Option A. Flushing only removes loose debris and cannot physically detach adhered biofilm from the lumen walls. This option would be correct if the question asked what the final step is to rinse away loosened soil after brushing. Option B. Soaking softens the bioburden but does not physically remove it. This option would be correct if the question asked what preliminary step should be performed immediately upon receiving a dried bloody instrument to begin breaking down the proteins. Option C. A stylet is used to poke out solid chunks like bone or tissue, but it does not scrub the lumen walls clean. This option would be correct if the question asked how to dislodge a piece of bone tightly wedged inside a suction tip. Concept extension. Brushes used for lumens must be inspected for wear and sized correctly. If a brush is too small, it will not touch the walls, and if it is too large, it may damage the instrument or become stuck. Question 8. A technician is newly assigned to the endoscopy reprocessing area. The supervisor provides an orientation emphasizing the unique challenges of handling flexible colonoscopes compared to standard stainless steel surgical instruments. What operational reality must the technician strictly anticipate regarding these complex devices? A. Their robust internal construction makes them highly resistant to physical impact damage during transport. B. The manual cleaning phase requires numerous intricate steps that take significant time to complete. C. The preferred and safest method for removing debris from their channels is utilizing an ultrasonic cleaner. D. They must be routinely subjected to high-heat steam sterilization cycles to ensure terminal lethality. Correct answer B. Knowledge point explanation. Core rationale. Flexible endoscopes are considered the most complex and difficult to clean medical devices in a hospital. Their long, narrow internal channels, delicate optics, and numerous control valves dictate a highly meticulous multi-step manual cleaning process that is inherently very time-consuming and cannot be rushed. Trap analysis. Option A. Flexible endoscopes are extremely fragile and easily damaged if dropped or bumped. This option would be correct if the question were describing solid stainless steel retractors placed in a rigid protective container. Option C. Ultrasonic cleaners generate intense vibrations that will permanently destroy the delicate fiber optics and seals inside a flexible endoscope. This option would be correct if the technician were cleaning stainless steel box lock instruments like hemostats. Option D. Flexible endoscopes are strictly heat-sensitive and will be completely melted by steam sterilization. This option would be correct if the question asked how to process a standard set of surgical chisels and osteotomes. Concept extension. Due to the time-consuming nature of this process, technicians must strictly adhere to the manufacturer instructions for use, avoiding any shortcuts to prevent dangerous cross-contamination between patients. Question 9. A technician is preparing to manually submerge a cleaned flexible bronchoscope into a soaking basin filled with a glutaraldehyde high-level disinfectant. What specific residual substance left on the exterior of the scope would directly neutralize the active biocidal chemicals in this solution and cause a severe disinfection failure? A. Microscopic traces of a neutral pH enzymatic detergent from the washing sink. B. Residual critical water droplets remaining from the final rinse phase. C. Leftover organic materials such as gross blood tissue or fecal matter. D. A microscopic buildup of passive chromium oxide on the metal components. Correct answer C. Knowledge point explanation. Core rationale. The absolute golden rule of sterile processing is that an item cannot be disinfected or sterilized if it is not completely clean. Residual organic materials like blood tissue and fat act as a physical barrier and biochemically react with the disinfectant. The chemical essentially attacks the organic dirt instead of the target microorganisms, rendering the solution ineffective. Trap analysis. Option A. Detergent traces should be rinsed away, but they do not actively deactivate the chemical action of glutaraldehyde in the same catastrophic manner as gross organic bioburden. This option would be correct if the question asked what residue causes instruments to feel slippery and requires thorough rinsing with utility water. Option B. Water droplets will slowly dilute the disinfectant over multiple uses, lowering its minimum effective concentration, but they do not instantly neutralize the chemical reaction. This option would be correct if the question asked what causes a hydrogen peroxide sterilizer cycle to immediately abort. Option D. Chromium oxide is the protective invisible layer that makes stainless steel rust-resistant and does not interact with disinfectants. This option would be correct if the question asked what chemical layer is created on a surgical clamp during the manufacturing passivation process. Concept extension. To prevent dilution, technicians must ensure that instruments are thoroughly dried with a lint-free cloth before they are placed into a high-level disinfectant soaking basin. Question 10. A technician receives a heavily contaminated flexible gastroscope in the decontamination sink area straight from a procedure room. Before submerging the delicate device in fluid or applying any enzymatic detergent, what critical initial diagnostic procedure must the technician execute? A. Pressurizing the scope with a dedicated device to identify any unseen breaches in its outer casing. B. Flushing all internal channels with a high-pressure alcohol solution to facilitate rapid internal drying. C. Manually scrubbing the exterior bending rubber with a soft bristled brush to remove gross fecal matter. D. Submerging the entire device in an intermediate level disinfectant to protect the technician during cleaning. Correct answer A. Knowledge point explanation. Core rationale. The absolute first step in processing any flexible endoscope is performing a wet or dry leak test. This process introduces air pressure into the internal cavity of the scope to check for holes or tears in the outer sheath. If a technician skips this step and submerges a damaged scope, water will flood the internal electronics and fiber optics, causing catastrophic financial damage to the device. Trap analysis. Option B. Alcohol is strictly used at the very end of the entire reprocessing cycle to aid in drying the channels before storage. This option would be correct if the question asked for the final step performed immediately prior to hanging the scope in a dedicated drying cabinet. Option C. Manual brushing is a mandatory step, but it can only occur after the leak test confirms the scope is watertight and safe to be submerged in the washing sink. This option would be correct if the question asked what physical action follows the enzymatic soaking phase. Option D. Instruments are never pre-soaked in disinfectants before cleaning because soil neutralizes the chemical and the chemicals can fixate proteins. This option would be correct if the question incorrectly described an outdated and dangerous practice for handling biohazardous items. Concept extension. If continuous bubbles are observed emerging from the distal tip during a wet leak test, the technician must immediately remove the scope from the water and tag it for factory repair. Question 11. A technician in the prep and pack area is printing a sterilization label for a generic major basic tray. The technician verifies the lot control number and description. Which piece of data is the technician strictly not required to include on this label? A. A clear description detailing the internal contents of the package. B. The unique lot control number containing the date and cycle. C. The specific name of the surgical procedure's requesting physician. D. The identification code of the specific autoclave being utilized. Correct answer C. Knowledge point explanation. Core rationale. A sterile package label must contain all data necessary for traceability, such as the sterilizer number, the cycle number, and the date of sterilization. Because most standard sterile trays are generic and can be utilized by any doctor, the specific surgeon's name is not a mandatory labeling requirement according to AAMI standards. Trap analysis. Option A. The description of package contents is a mandatory requirement for identifying the item. This option would be correct if the question asked what information allows a scrub tech to instantly know what is inside an opaque wrapped tray. Option B. The lot control number is the most critical piece of traceability data required on every label. This option would be correct if the question asked what specific number sequence must be documented to execute a successful recall of a failed sterilization load. Option D. The sterilizer identification is part of the mandatory lot control number. This option would be correct if the question asked what data point helps investigators determine exactly which machine caused a wet pack incident. Concept extension. If a label is missing the lot control number, the tray cannot be tracked and must be considered unsterile and completely reprocessed. Question 12. While assembling a minor soft tissue set, a technician inspects an instrument designed to grasp and hold slippery tissue securely. The technician checks the distal tip and confirms the presence of interlocking structures. Which specific instrument feature is the technician visually verifying? A. The serrated or tungsten carbide jaws of a needle holder. B. The single sharp beveled blade of a heavy bone chisel. C. The small interlocking teeth of a standard tissue forceps. D. The blunt smooth gripping surface of a delicate intestinal clamp. Correct answer C. Knowledge point explanation. Core rationale. Tissue forceps, also commonly called pickups, are specifically engineered to grasp and manipulate tissue during surgical procedures. To achieve a secure hold without slipping, these instruments frequently feature small interlocking teeth at their very tip, such as an Adson forceps with a 1x2 teeth configuration. Trap analysis. Option A. Needle holders utilize serrations or tungsten carbide inserts to securely grip a smooth metal suturing needle rather than living tissue. This option would be correct if the question asked what feature prevents a curved suture needle from rotating during tissue repair. Option B. Chisels are cutting instruments lacking teeth that rely on a single sharpened edge. This option would be correct if the question asked what heavy instrument requires a mallet to carve or shave pieces of dense bone. Option D. Intestinal clamps utilize smooth or specialized atraumatic jaws to hold the bowel without crushing it. This option would be correct if the question asked what instrument feature is required to temporarily occlude a delicate blood vessel without causing permanent tissue damage. Concept extension. When testing tissue forceps, a technician must ensure the teeth align perfectly and do not overlap or catch improperly when the handle is gently squeezed. Question 13. A department manager is reviewing the facility legal reporting protocols under the Safe Medical Device Act following an incident where a defective sterilized instrument caused a patient injury. According to this specific regulation, which of the following entities is legally mandated to report suspected medical device-related deaths to the FDA? A. Only the original manufacturer of the defective medical device. B. Only the hospital or healthcare facility where the incident occurred. C. Both the healthcare facility utilizing the device and the original device manufacturer. D. Only the independent third-party regulatory auditing agency. Correct answer C. Knowledge point explanation. Core rationale. The Safe Medical Device Act establishes strict mandatory reporting requirements for adverse events. If a medical device causes or contributes to a serious injury or death, the law clearly dictates that both the healthcare facility, including hospitals and nursing homes, and the device manufacturer must legally report the incident to the FDA. Trap analysis. Option A. Manufacturers are required to report, but they are not the only entity. This option would be correct if the question asked who is solely responsible for submitting a 510(k) pre-market notification to the FDA before a new device is sold. Option B. Healthcare facilities must report, but the responsibility is shared with the manufacturer. This option would be correct if the question asked who is solely responsible for physically quarantining the exact defective item inside the hospital after an incident. Option D. Third-party auditors monitor compliance but do not initiate primary incident reports. This option would be correct if the question asked who conducts an unannounced hospital-wide accreditation survey every 3 years. Concept extension. If a technician discovers a heavily damaged instrument that caused a surgical delay, they must immediately remove it from service, tag it, and report it to the supervisor to initiate an internal incident report. Question 14. An environmental services worker is assigned to clean the floors in the decontamination and prep areas of the sterile processing department at the end of the evening shift. To strictly prevent the aerosolization of dangerous microscopic spores, which specific cleaning technique must the worker execute? A. Wet mopping the entire floor surface on a daily basis. B. Dry sweeping the floor daily followed by a weekly wet mop. C. Utilizing a dry broom to gather visible debris daily. D. Wet mopping the floors only on a strict weekly schedule. Correct answer A. Knowledge point explanation. Core rationale. Infection control protocols mandate that dry sweeping or using a dry broom is strictly forbidden in any area of the sterile processing department. Sweeping physically kicks dust, lint, and dormant microorganisms up into the ambient air where they can contaminate sterile packages or be inhaled by staff. Floors must be wet mopped daily because the moisture traps the debris and prevents it from becoming airborne. Trap analysis. Option B. Dry sweeping is never permitted regardless of subsequent wet mopping. This option would be correct if the question described an acceptable cleaning method for an outdoor loading dock where sterile supplies are never present. Option C. A dry broom creates a massive biohazard aerosolization risk. This option would be correct if the question asked what exact cleaning action will guarantee an immediate critical failure during an infection control audit. Option D. Wet mopping must be performed daily, not weekly, to control bioburden. This option would be correct if the question asked how often overhead air vents and high light fixtures must be routinely cleaned. Concept extension. The mop head used in the decontamination area must never be used in the clean prep area or sterile storage area to strictly prevent cross-contamination between zones. Question 15. A laboratory technician receives a swab from a contaminated surgical instrument found in the sterile storage area. To begin identifying the unknown microorganism cell wall structure and separating it into either a purple or pink classification, which specific staining process will the technician initiate first? A. An acid-fast staining procedure. B. A Ziehl-Neelsen staining protocol. C. A gram staining classification process. D. A specialized skin test diagnostic. Correct answer C. Knowledge point explanation. Core rationale. The gram stain is the most fundamental and frequently utilized staining method in microbiology. It functions as the first critical diagnostic step to identify bacteria by targeting their cell wall structure, separating them into gram-positive, which stain purple, or gram-negative, which stain pink. This helps determine the appropriate disinfection or treatment strategy. Trap analysis. Option A. Acid-fast staining is only used for specific bacteria that resist standard gram staining. This option would be correct if the question asked what specific staining method must be used to identify Mycobacterium tuberculosis. Option B. Ziehl-Neelsen is simply another name for the acid-fast stain. This option would be correct if the question asked for the eponymous name of the acid-fast protocol used for tuberculosis. Option D. A skin test is an in vivo diagnostic performed on a living patient, not a laboratory cell wall stain. This option would be correct if the question asked how a healthcare worker is routinely screened for latent tuberculosis exposure. Concept extension. Gram-positive bacteria like Staphylococcus are generally easier to kill with standard disinfectants than gram-negative bacteria like Pseudomonas, which form tough protective biofilms. Question 16. While inspecting a brand new stainless steel hemostat for the first time, a technician notices its highly rust-resistant surface. The educator explains this invisible chromium oxide layer was created during the final manufacturing stage. What is the precise name of this chemical bath process? A. Passivation. B. Tempering. C. Polishing. D. Forging. Correct answer A. Knowledge point explanation. Core rationale. Passivation is a specific chemical bath utilizing nitric acid performed by the manufacturer to remove free iron from the surface of a new instrument. This chemical reaction allows the remaining chromium to bond with oxygen, creating an invisible passive layer that provides the instrument with its primary defense against corrosion and rust. Trap analysis. Option B. Tempering is a thermal heating and cooling process designed to make the raw metal hard but not brittle. This option would be correct if the question asked what manufacturing step prevents a surgical blade from shattering under pressure. Option C. Polishing is a physical buffing process used to create a smooth or mirror finish on the metal. This option would be correct if the question asked what mechanical step is taken to reduce surface glare on a surgical retractor. Option D. Forging is the initial brute force step of hammering heated raw metal into its basic physical shape. This option would be correct if the question asked what creates the initial rough mold of a box lock instrument before milling begins. Concept extension. If a technician uses harsh abrasive cleaners or metal wire brushes during decontamination, they will physically strip away this passivation layer, causing the instrument to quickly rust. Question 17. A technician in the prep area is utilizing an electronic testing device to inspect the plastic insulation coating on a long laparoscopic grasper. To prevent severe internal patient electrical burns, where must the technician initially direct their physical inspection? A. The connection collar located at the distal tip. B. The ergonomic finger rings on the proximal handle. C. The flush port mechanism near the shaft base. D. The internal pull wire running through the shaft. Correct answer A. Knowledge point explanation. Core rationale. Laparoscopic instruments frequently utilize electrical current at their distal tip to cauterize tissue. The insulation coating protects the patient tissue along the length of the shaft. The most common point of insulation failure is the distal collar, where the metal working tip joins the insulated shaft, making it the most critical initial inspection point. Trap analysis. Option B. The proximal handle finger rings do not enter the patient body cavity and do not carry an insulation burn risk. This option would be correct if the question asked where a technician should check for stiffness or ratcheting defects. Option C. The flush port is utilized for cleaning access and is not the primary site of electrical insulation failure. This option would be correct if the question asked what component must be securely capped before placing the instrument into an ultrasonic cleaner. Option D. Internal pull wires control articulation and cannot be visually inspected for outer insulation tears. This option would be correct if the question asked what hidden component causes a robotic instrument to smoothly bend its wrist. Concept extension. A microscopic crack in the insulation that is entirely invisible to the naked eye can allow electrical current to arc and cause fatal internal injuries, requiring mandatory use of a laparoscopic insulation tester. Question 18. While loading a sterilization cart, a technician is organizing multiple peel pouches containing minor instruments. To ensure adequate steam penetration and subsequent drying, how must the technician physically align these specific packages on the metal rack? A. Positioned on edge with the paper side facing the plastic side of the adjacent pouch. B. Positioned on edge with the paper side directly facing the paper side of the adjacent pouch. C. Laid completely flat with the plastic side facing upward toward the sterilizer ceiling. D. Laid completely flat with the paper side facing downward toward the sterilizer floor. Correct answer A. Knowledge point explanation. Core rationale. The golden rule for loading peel pouches is that they must stand on edge. Because only the paper side is porous, placing them paper to plastic ensures the sterilant can easily enter the paper side of one pouch while simultaneously allowing the plastic side of the adjacent pouch to effectively radiate heat for drying. Trap analysis. Option B. Placing pouches paper to paper blocks the porous sides of both pouches entirely, preventing steam from entering and causing a total sterilization failure. This option would be correct if the question asked what specific loading error guarantees a biological indicator failure in a pouch load. Option C. Laying pouches flat with the plastic side up allows heavy water condensation to pool on top of the plastic, causing severe wet packs. This option would be correct if the question asked what incorrect loading technique causes visible water puddles on removed packages. Option D. Laying pouches flat with the paper side down prevents proper air removal from the package and suffocates the drying process. This option would be correct if the question asked what flat loading technique causes the paper fibers to absorb rack moisture and tear easily. Concept extension. Technicians should utilize specialized metal or plastic pouch racks to keep the pouches standing on edge with appropriate spacing to facilitate unobstructed steam circulation. Question 19. A technician is preparing a set of Kelly hemostats that a surgeon will utilize to clamp active bleeding inside the abdominal cavity. Under the Spaulding classification system, which category dictates the mandatory terminal reprocessing requirement for these specific surgical items? A. Critical category. B. Semi-critical category. C. Non-critical category. D. Biohazardous category. Correct answer A. Knowledge point explanation. Core rationale. The Spaulding classification system strictly categorizes medical devices based on their infection risk. Because a hemostat is introduced directly into the human bloodstream and sterile internal body tissues, it carries the absolute highest risk of transmitting infection. Therefore, it is classified as a critical item and must undergo complete sterilization. Trap analysis. Option B. Semi-critical items contact intact mucous membranes but do not penetrate sterile tissue. This option would be correct if the technician were processing a flexible gastroscope or an anesthesia breathing circuit, which only require high-level disinfection. Option C. Non-critical items only touch intact skin and pose the lowest risk. This option would be correct if the technician were wiping down a blood pressure cuff or a patient transport stretcher using a low-level environmental disinfectant. Option D. Biohazardous is a safety warning label designating infectious material, not a Spaulding processing category. This option would be correct if the question asked what specific red-colored warning sign must be placed on a cart transporting soiled instruments. Concept extension. If a critical item cannot withstand the high heat of steam sterilization, the technician must select a low-temperature sterilization method such as hydrogen peroxide or ethylene oxide, but it must still achieve complete sterilization. Question 20. A technician is manually scrubbing a complex orthopedic reamer in the decontamination area utilizing a standard 3-sink setup. When the technician transfers the instrument into the third sink to complete the final rinsing phase, what specific fluid must fill this basin? A. Highly treated critical water. B. Warm utility tap water. C. A low-foaming enzymatic solution. D. A high-level glutaraldehyde disinfectant. Correct answer A. Knowledge point explanation. Core rationale. The 3-sink manual cleaning method strictly separates the washing and rinsing phases. The third and final sink must exclusively utilize critical water such as deionized or reverse osmosis water. This highly purified water removes all residual hard minerals from the tap water, preventing severe instrument staining, corrosion, and microscopic rust formation prior to sterilization. Trap analysis. Option B. Utility tap water contains heavy minerals and is only used in the first and second sinks for initial washing and intermediate rinsing. This option would be correct if the question asked what fluid is used in the middle sink to rapidly flush away thick detergent suds. Option C. Enzymatic solutions actively break down proteins and belong strictly in the first wash sink. This option would be correct if the question asked what chemical agent is added to the very first soaking basin to loosen dried blood. Option D. High-level disinfectants are toxic and are never placed in an open manual scrubbing sink due to severe employee vapor exposure risks. This option would be correct if the question asked what chemical is utilized inside an automated endoscope reprocessor to kill remaining pathogens after manual cleaning is fully complete. Concept extension. Failure to use critical water for the final rinse will result in hard water spots, which can shield microorganisms during the sterilization cycle and cause the instruments to fail visual inspection. Question 21. A technician is monitoring the exhaust ventilation system on a newly installed ethylene oxide sterilizer before initiating a cycle. They are reviewing facility compliance logs regarding the maximum allowable toxic gas vented directly into the outside atmosphere. Which federal organization strictly establishes these specific external environmental limits? A. The Occupational Safety and Health Administration. B. The Food and Drug Administration. C. The Environmental Protection Agency. D. The World Health Organization. Correct answer C. Knowledge point explanation. Core rationale. ethylene oxide is a highly toxic and carcinogenic sterilant gas. Because venting this chemical into the outside air poses a significant pollution risk to the surrounding community, the Environmental Protection Agency strictly regulates its emission standards to protect the external environment. Trap analysis. Option A. OSHA regulates internal worker safety, such as setting the permissible exposure limit for employees working inside the room with the sterilizer. This option would be correct if the question asked which agency mandates the use of personal protective equipment for the technician. Option B. The FDA regulates the manufacturing and validation of the medical devices and the sterilizers themselves. This option would be correct if the question asked which agency requires the sterilizer manufacturer to prove the machine effectively kills spores before it can be sold. Option D. The WHO is an international advisory body that provides global health guidelines rather than enforcing United States environmental laws. This option would be correct if the question asked what global entity publishes international pandemic response recommendations. Concept extension. Facilities utilizing this gas must install specialized catalytic converters or scrubbers on their exhaust systems to neutralize the chemical before it reaches the outside air, complying with EPA mandates. Question 22. A technician finishes clearing a bloody orthopedic setup from a third-floor operating room and needs to return the items to the basement decontamination area. To strictly minimize cross-contamination risks to the public and staff, which pathway must the technician utilize to move this biohazardous enclosed cart? A. An open-wire transport cart open to the hallway air. B. A dedicated soiled elevator solely used for contaminated items. C. A standard patient elevator shared with hospital visitors. D. A high-traffic public corridor during peak shift change hours. Correct answer B. Knowledge point explanation. Core rationale. Contaminated surgical instruments are a significant biohazard. The safest and most effective method to transport these items between floors is utilizing a dedicated soiled elevator. This physical isolation completely prevents airborne cross-contamination or accidental contact with clean supplies, patients, and unprotected personnel. Trap analysis. Option A. Open wire carts provide zero barrier protection, allowing fluids to drip and airborne microbes to spread. This option would be correct if the technician were transporting completely sterilized and fully cooled rigid containers to a sterile storage shelf. Option C. Mixing biohazardous materials with the general public or vulnerable patients is a direct violation of severe infection control policies. This option would be correct if the question asked where an employee might transport a clean empty wheelchair. Option D. High traffic areas exponentially increase the risk of accidental exposure during transport. This option would be correct if the question asked what specific pathway must be strictly avoided when designing a facility transport route for soiled items. Concept extension. Even when using a dedicated elevator, the cart itself must still be completely enclosed, leak-proof, and clearly labeled with a red biohazard symbol. Question 23. During a morning huddle before entering the decontamination sink area, a supervisor instructs a new technician to remove their diamond engagement ring and wristwatch. What is the primary infection control rationale for strictly prohibiting these personal items during hands-on processing tasks? A. The intricate crevices inherently harbor dangerous transient microorganisms. B. The high replacement cost poses a liability issue for the healthcare facility. C. The harsh alkaline detergents will chemically degrade the precious metals. D. The physical protrusion increases the likelihood of snagging and tearing personal protective equipment. Correct answer A. Knowledge point explanation. Core rationale. Jewelry contains microscopic scratches, crevices, and stone settings that create perfect hiding places for bacteria and fungi. Standard handwashing cannot effectively remove microbes trapped in these tight spaces, allowing them to be easily transferred to medical devices and posing a severe infection risk to surgical patients. Trap analysis. Option B. While financial liability is a real concern for personal property, it is not the clinical infection control reason mandated by AAMI standards. This option would be correct if the question asked why a human resources policy discourages bringing large amounts of cash to work. Option C. Detergents can indeed damage jewelry, but protecting the item is a secondary personal concern, not a patient safety rule. This option would be correct if the question asked why an employee chooses to leave a silver necklace at home rather than wearing it under a scrub top. Option D. While snagging gloves is a secondary physical hazard, the primary microbiological danger is the inability to achieve clean hands. This option would be correct if the question asked why technicians must keep their natural fingernails trimmed extremely short. Concept extension. Artificial nails and chipped nail polish are also strictly prohibited in the sterile processing department for the exact same reason, as they easily trap and harbor high levels of fungal and bacterial bioburden. Question 24. An operating room scrub nurse is wiping down a stainless steel retractor with a sterile water-moistened sponge immediately after it was removed from a patient abdomen, effectively removing large visible chunks of adipose tissue and clotted blood. In sterile processing terminology, what specific classification describes this heavy visible debris? A. Gross soil. B. Microscopic bioburden. C. Regulated biohazard waste. D. Polymeric biofilm layer. Correct answer A. Knowledge point explanation. Core rationale. Gross soil is the exact technical term utilized to describe massive, highly visible contaminants on a surgical instrument immediately following use. This includes tangible substances such as chunks of tissue, bone fragments, marrow, and pooled blood, which must be wiped off at the point of use to prevent hardening. Trap analysis. Option B. Bioburden specifically refers to the invisible number of microbial colonies residing on an item before it is sterilized. This option would be correct if the question asked what specific invisible metric is used to determine the necessary lethality time for a sterilization cycle. Option C. Biohazard waste refers to the disposal category of the saturated sponge itself rather than the soil remaining on the instrument surface. This option would be correct if the question asked into which specific red bag the scrub nurse must throw the dripping bloody sponge. Option D. A biofilm is a tight, invisible, slimy layer formed by bacteria reacting with water over time, not fresh, visible chunks of human tissue. This option would be correct if the question asked what highly resistant slime barrier forms inside a lumen when an instrument is left dirty overnight. Concept extension. Removing gross soil at the point of use prevents blood proteins from drying and pitting the stainless steel, which directly protects the passivation layer of the instrument. Question 25. A technician takes a short break and proceeds to the restroom sink to clean their hands before returning to handle freshly sterilized instrument trays in the clean assembly area. After dispensing antimicrobial soap and creating a friction lather, what is the absolute minimum duration the technician must physically rub their hands together to meet standard infection prevention protocols? A. 10 continuous seconds. B. 20 continuous seconds. C. 1 full continuous minute. D. 2 full continuous minutes. Correct answer B. Knowledge point explanation. Core rationale. Routine hand washing is the single most important action to prevent cross-contamination. The Centers for Disease Control and Prevention and AAMI standards strictly mandate that healthcare workers lather and physically scrub their hands for a minimum of 20 seconds to effectively dislodge transient floor and soil from the skin surfaces. Trap analysis. Option A. 10 seconds is insufficient to generate enough mechanical friction to detach dangerous microbes from skin crevices. This option would be correct if the question incorrectly stated a common public misconception about rapid hand rinsing. Option C. 1 minute is an excessive duration for a routine hygiene wash in a non-operative setting. This option would be correct if the question asked what duration might be required for an extended medical hand wash after known exposure to a heavily virulent pathogen. Option D. 2 to 6 minutes is the stringent requirement for a formal surgical scrub using a specialized sponge brush. This option would be correct if the question asked how long an operating room scrub technician must wash their hands and forearms immediately prior to donning a sterile surgical gown. Concept extension. If a technician's hands are not visibly soiled, using an alcohol-based hand rub for at least 20 seconds until completely dry is an acceptable alternative to soap and water for routine decontamination. Question 26. A technician in the decontamination area is reviewing a safety bulletin about processing bronchoscopes utilized on patients infected with a highly resilient respiratory pathogen. The bulletin specifies the causative agent is a classic rod-shaped bacterium. Which of the following specific microorganisms fits this exact morphological description? A. Staphylococcus. B. Mycobacterium tuberculosis. C. Enterococcus. D. Acinetobacter. Correct answer B. Knowledge point explanation. Core rationale. In microbiology, bacteria are classified by their physical shape. Mycobacterium tuberculosis, the pathogen responsible for causing tuberculosis, is the classic textbook example of a rod-shaped bacterium, also scientifically known as a bacillus. It is also the benchmark organism used to test the efficacy of high-level disinfectants due to its tough waxy cell wall. Trap analysis. Option A. Staphylococcus translates to a cluster of grapes shape, meaning it is a spherical-shaped bacterium. This option would be correct if the question asked to identify the shape of the common skin microbe responsible for surgical site infections. Option C. Enterococcus utilizes the suffix coccus, meaning it is strictly a spherical-shaped bacterium. This option would be correct if the question asked to identify a spherical microbe commonly found residing naturally in the human intestinal tract. Option D. Acinetobacter is categorized as a coccobacillus, which is an extremely short and fat rod that deceptively looks like a sphere under a microscope. This option would be correct if the question asked to identify a highly tricky bacterium that blurs the visual line between a rod and a sphere. Concept extension. Mycobacterium tuberculosis is an acid-fast bacterium, meaning it cannot be identified using a standard gram stain and requires the specialized Zeil-Nielsen staining protocol to become visible under a microscope. Question 27. While assembling a complex orthopedic sports medicine tray, a technician inspects a specialized optical instrument labeled for an upcoming arthroscopy procedure. Based on the specific suffix utilized in this medical terminology, what exact physical action will the surgeon perform using this specific device? A. Visual examination of the internal joint space. B. Surgical removal of the damaged bone tissue. C. Complete artificial reconstruction of the joint structure. D. Creation of a new permanent opening into the cavity. Correct answer A. Knowledge point explanation. Core rationale. Understanding medical terminology is a critical skill for sterile processing technicians to correctly identify requested instruments. The suffix scopy translates directly to utilizing a lighted optical instrument to perform a visual examination of a body cavity. When combined with the root arthro, meaning joint, it indicates the surgeon will visually inspect the inside of the joint. Trap analysis. Option B. The surgical removal of a body part utilizes the specific suffix ectomy. This option would be correct if the technician were preparing heavy rongeurs and curettes for a laminectomy procedure. Option C. The artificial reconstruction or surgical repair of a structure utilizes the suffix plasty. This option would be correct if the technician were gathering total knee implant components for an arthroplasty procedure. Option D. Creating a new permanent opening to the outside of the body utilizes the suffix ostomy. This option would be correct if the technician were preparing a specialized tray for a colostomy procedure. Concept extension. Instruments used for scopy procedures usually contain extremely fragile glass fiber optics and must be carefully segregated from heavy metal retractors during sink decontamination to prevent catastrophic lens damage. Question 28. A technician assigned to the sterile storage tracking system is generating digital pick lists for a massive schedule of total knee and hip replacements. To maximize departmental workflow efficiency and strictly prevent any morning operating room delays, at what exact operational time should the technician physically pull the supplies for these scheduled cases? A. Precisely 2 full days prior to the scheduled incision time. B. during the day or evening shift immediately prior to the surgery date. C. At the absolute beginning of the morning shift on the day of the procedure. D. Exactly 1 hour before each individual patient enters the operating room. Correct answer B. Knowledge point explanation. Core rationale. The established industry best practice for case card assembly is pulling the required instrument trays and disposable supplies the day or evening before the scheduled procedure. This proactive workflow provides the sterile processing department with an adequate time buffer to locate missing items, sterilize backup trays, or communicate with vendors, preventing catastrophic surgical delays. Trap analysis. Option A. Pulling cases 2 full days in advance is highly inefficient because it temporarily hoards critical instruments that might be urgently needed for other emergency surgeries. This option would be correct if the question asked for the absolute minimum time window a vendor loaner tray must arrive at the facility prior to a surgery. Option C. Waiting until the morning of the surgery provides zero buffer time to resolve unexpected missing instruments, causing immediate delays to the first scheduled patient. This option would be correct if the question asked when a technician must pull an emergency add-on case that was not on the original schedule. Option D. Pulling items 1 hour before surgery is a dangerous just-in-time inventory practice that guarantees extreme stress and high failure rates. This option would be correct if the question asked to identify an operational workflow that AAMI guidelines strictly discourage for routine scheduled procedures. Concept extension. Once a case cart is fully assembled the evening before the surgery, it must be staged in a designated clean holding area to protect the sterile barriers from unnecessary handling and environmental dust. Question 29. A technician in the clean assembly area is verifying the contents of a specialized ear, nose, and throat tray requested for an upcoming scheduled septoplasty. Based on the explicit medical terminology defining this specific procedure, what precise anatomical correction is the surgeon preparing to physically perform? A. Repairing a severe laceration in the small intestine mucosa. B. Reconstructing a severed tendon sheath in the patient hand. C. Removing infected dead tissue from a deep septic wound. D. Surgically straightening a deviated internal nasal structure. Correct answer D. Knowledge point explanation. Core rationale. Medical terminology is built using specific roots and suffixes. The root word septo refers to a septum, and in the context of an ENT tray, it specifically designates the nasal septum. The suffix plasty translates to surgical repair or reconstruction. Therefore, a septoplasty is the physical surgical reconstruction to straighten a deviated nasal septum, improving the patient airway. Trap analysis. Option A. Repairing the small intestine utilizes the root entero, resulting in the term enteroplasty. This option would be correct if the technician were assembling a major abdominal tray for a patient undergoing a bowel reconstruction. Option B. Reconstructing a severed tendon utilizes the root teno, resulting in the term tenoplasty. This option would be correct if the technician were inspecting delicate micro scissors for a hand surgery procedure. Option C. A septic wound implies an active systemic infection caused by pathogens which has no linguistic connection to the anatomical root word septo. This option would be correct if the question asked to define the surgical procedure known as wound debridement. Concept extension. Instruments used in a septoplasty are typically very delicate and include specialized nasal speculums and small bone rasps that require extreme care during manual brushing to prevent dulling their sharp edges. Question 30. A technician in the decontamination room receives a dropped heavy bone rongeur from the operating room, accompanied by an urgent demand to process it via an immediate use steam sterilization cycle. What exact physical preparation steps must the technician execute on this soiled instrument before it can legally be placed into the autoclave chamber? A. Perform a complete and thorough manual cleaning process exactly like a terminal sterilization load. B. Quickly wipe the visible blood off the handles, since the extreme heat will destroy the remaining bioburden. C. Bypass the time-consuming manual scrubbing phase and place it directly into the mechanical washer disinfector. D. Submerge the item in an intermediate level disinfectant for 5 minutes to safely skip the sink washing phase. Correct answer A. Knowledge point explanation. Core rationale. The absolute unbending golden rule of all sterile processing is that if an item is not completely clean, it fundamentally cannot be sterilized. Immediate use steam sterilization only alters the packaging and shortens the sterilization exposure phase. It never under any circumstance allows a technician to bypass, shorten, or alter the mandatory rigorous multi-step decontamination and cleaning process required by the manufacturer. Trap analysis. Option B. Wiping handles leaves heavy bioburden hidden inside the box locks, which acts as an impenetrable shield preventing steam from touching the metal. This option would be correct if the question asked what temporary action a scrub nurse performs at the surgical field to prevent gross soil from drying out before transport. Option C. Bypassing manual scrubbing is a critical safety violation because mechanical washers cannot adequately remove dried blood from complex box locks without initial manual friction. This option would be correct if the question asked what dangerous and illegal shortcut technicians are often tempted to take when severely pressured by operating room staff. Option D. Disinfectants are not cleaning agents, and submerging a bloody instrument in them will chemically fixate the proteins onto the metal, rendering it impossible to clean. This option would be correct if the question asked what prohibited and outdated facility practice was previously utilized for soaking biohazardous instruments prior to transport. Concept extension. Even when an instrument is urgently needed, the technician must strictly follow the specific manufacturer instructions for use regarding appropriate brush sizes, enzymatic soaking times, and thorough rinsing protocols. Question 31. A technician is conducting a routine physical safety inspection of a massive bulk steam sterilizer. Which specific structural component must the technician scrutinize most carefully because it is universally considered the most vulnerable point of the pressurized chamber? A. The outer insulating water jacket. B. The interior floor drain screen. C. The heavy front-loading door. D. The external thermostatic steam trap valve. Correct answer C. Knowledge point explanation. Core rationale. The door is subjected to constant physical handling, slamming, and extreme cycles of thermal expansion and pressure. Any defect in the heavy metal door itself or its integrated sealing gasket will cause a catastrophic steam leak and subsequent cycle failure, making it the weakest link. Trap analysis. Option A. The outer insulating water jacket is a rigid stationary structure that surrounds the chamber and rarely fails physically. This option would be correct if the question asked what component continuously preheats the chamber walls to prevent internal condensation. Option B. The interior floor drain screen is highly vulnerable to getting clogged with debris, but it is not a structural weak point of the pressurized metal vessel. This option would be correct if the question asked what removable component frequently causes a vacuum failure if blocked by tape. Option D. The external thermostatic steam trap valve regulates steam but is not the primary structural weak point of the main chamber. This option would be correct if the question asked what component automatically discharges air and cool condensate from the exhaust line. Concept extension. Technicians must thoroughly wipe the door gasket daily with a clean damp cloth to remove abrasive lint and inspect for microscopic cracks to maintain the integrity of this critical weak point. Question 32. An educator is auditing a sterile storage room and observing how technicians handle wrapped trays. According to the principles of event-related sterility, which specific factor poses the greatest daily threat to compromising the sterile integrity of these packages on the shelves? A. The precise type of breathable material utilized for the outer packaging. B. The complexity of the surgical procedure for which the item is intended. C. The physical handling by staff and the ambient environmental conditions of the room. D. The specific high or low temperature sterilization modality originally utilized. Correct answer C. Knowledge point explanation. Core rationale. Event-related sterility dictates that items do not magically expire simply because a certain amount of time passes. Instead, sterility is compromised by specific events such as excessive physical handling, dropping, crushing by personnel, or environmental factors like dust, water leaks, and high humidity. Trap analysis. Option A. The type of packaging material dictates how long it can withstand general storage but is not the daily dynamic threat to an already packaged item. This option would be correct if the question asked what determines if an item can be sterilized using hydrogen peroxide versus steam. Option B. The intended surgical procedure has absolutely no bearing on the physical maintenance of the package on the shelf. This option would be correct if the question asked what clinical factor dictates whether an instrument must be processed as a critical or semi-critical item. Option D. The original sterilization method does not affect how the package is physically maintained on the shelf once it is cool and dry. This option would be correct if the question asked what factor determines the mandatory required aeration time before an item can be safely moved to storage. Concept extension. Limiting the physical touching of sterile packs to a maximum of 4 times from sterilizer cart to shelf to case cart to operating room minimizes the risk of event-related contamination. Question 33. A technician is preparing a delicate heat-sensitive device for a lengthy ethylene oxide sterilization cycle. When selecting the appropriate outer containment, which specific material must the technician strictly avoid because it completely blocks the necessary chemical gas penetration? A. A combination paper and plastic peel pouch. B. A solid sheet of impermeable aluminum foil. C. A specialized synthetic spunbond Tyvek pouch. D. A standard disposable porous polypropylene wrapper. Correct answer B. Knowledge point explanation. Core rationale. Ethylene oxide requires a porous packaging material to allow the toxic gas to enter, kill the spores, and then properly aerate out. Aluminum foil is a solid non-porous metal barrier that entirely prevents the gas from reaching the instruments inside, guaranteeing a sterile failure. Trap analysis. Option A. Paper and plastic pouches feature a highly porous paper side that readily allows ethylene oxide gas to penetrate. This option would be correct if the question asked what standard packaging is commonly utilized for single lightweight instruments in both steam and ethylene oxide. Option C. Tyvek pouches are fully compatible with and highly recommended for ethylene oxide because they are synthetic and extremely porous. This option would be correct if the question asked what specific packaging material is absolutely mandatory for a hydrogen peroxide gas plasma cycle. Option D. Disposable polypropylene wrappers are highly porous and widely approved for ethylene oxide cycles. This option would be correct if the question asked what blue synthetic material is commonly used to wrap heavy orthopedic trays for steam sterilization. Concept extension. Technicians must always meticulously verify the manufacturer instructions to ensure the chosen packaging material has been scientifically validated for the specific chemical sterilant being utilized.